The PERICLES Registry was the first attempt to collect the worldwide experience about the chimney or snorkel endovascular repair in the treatment of complex aortic pathologies. The problem was that we had a plethora of studies. However, they have severe limitations like the number of the treated cases, the heterogeneity of the treated pathologies. So no robust conclusion or no clear conclusion was obtained up to now. And with the PERICLES Registry, we focus on the chimney technique, and we evaluated the experience of 13 US and European centers, university centers, in the treatment of complex pathologies. Two are the key findings of this registry. The first point is that if we treat patients with the chimney technique, we have to be sure that we create a sufficient new sealing zone. And we identified for first time the needed length, which was 20 millimeter. New sealing zone should be the goal in order to have durable results. The other point which we have seen is the importance of oversizing for this technique. And we found that an oversizing of 30% for the main abdominal device is crucial, because you have to have enough fabric material to wrap up your chimney grafts. And in this context, the second important recommendation was an oversizing of 30% for the selected abdominal endografts. After that, we performed several subgroup analysis, and we published that also. For example, the impact or the importance in female patients which have more stenosed and elongated iliac access, or for example, the performance of the technique in type 1 endolysis after EVAR, or where are, for example, did we have prognostic factors regarding cerebrovascular deficits and problems. So we focus also on the limitations of this technique. I believe that we have to work to identify the ideal combinations of abdominal devices and chimney grafts. Regarding the combinations, we have seen very good results in the combination of the Endurance device with balloon expandable covered stents. This is one of the major also findings, but there is a still need to identify and to distinguish which combinations should be recommended, because we know that we use for this technique off-the-shelf devices, and this means that you have the flexibility theoretically to select each off-the-shelf device you like. However, we have seen different performances over the time, and this is important to know. Yes, of course, we have to perform also in vitro testing before we go to the in vivo experience to see exactly the ideal combination. We have to analyze also the access better to see, for instance, if an access, a route from the upper extremity having thrombotic material, the shaky aorta, can influence the results in a negative way. So we have also to focus on these details in order to optimize the results, and finally to suggest an alternative but complementary approach to the existing therapeutic options for the patients.